This is the third in a short series of video clips from the Adult Speech and Language Therapy Service in Ayrshire and Arran, designed to support basic dysphagia care. These clips are aimed at our whole community, including people living with dysphagia, their family and friends, carers and care home staff, and other professionals. In this video, we'll consider how speech and language therapists can help support those who are experiencing dysphagia. For further information about what dysphagia is and what signs to look out for, please see videos 1 and 2. Speech and language therapists play an important role in supporting adults who have eating, drinking and swallowing difficulties, helping them to eat and drink more safely. We work directly with individuals and indirectly to advise and train others in how to identify and manage swallowing difficulties more effectively. When someone's referred to our service, we will first have a telephone conversation with them or their relative or carer to discuss in detail what their concerns are. At this point, we may be able to offer appropriate advice over the phone to help them manage to eat and drink more safely, and may suggest other resources that could be beneficial. For those who need a specialist assessment, we will arrange to see them for a face-to-face appointment or visit. At our assessment, we will gather general information about the type of difficulties the individual's having, what their environment's like, how they sit, if they need help when eating and drinking, what their usual food preferences are, and so on. We will also directly assess for any weakness in their face, mouth and throat, and observe how they manage while eating and drinking. This information helps us make a diagnosis of dysphagia and to establish the level of risk from the swallowing difficulty. This then helps us decide how best to support the individual. Based on our assessment, we will have a discussion with the individual and their relative or carer about the options for management of their swallowing difficulty. We will agree with them what would best reduce their risk, but also allow them to maintain their quality of life and help them adjust to living as normally as possible with their swallowing difficulties. Our main aim is to ensure the safety of swallowing, to reduce or prevent the risk of aspiration, which can lead to further medical complications and in some cases admission to hospital. To do this, we may advise on the use of particular strategies and techniques when eating and drinking. We may advise a change to the texture of food or the thickness of drinks. This is done using the IDSI framework. Further information on this can be found in video clip 4. We'll discuss our advice in detail with the individual and their relatives or carers, and we'll leave a written summary of this on our Dysphagia Care Plan form, along with other supporting information if required. If appropriate, we may support the individual to improve their swallow by giving them advice on specific exercises, techniques, or positioning. We will also work closely with members of the health and care teams, especially the dietitian, to ensure that the individual is achieving their best nutrition and hydration. We may offer follow-up appointments or a review telephone call if we feel it's needed, but will always provide you with a contact number for any questions or concerns. Early identification and management of dysphagia by a speech and language therapist reduces the risk of medical complications and improves the quality of life for the individual.